Hello, and welcome to our program, Digital Slide Review and Sign Out. I'm Dr. Lewis Hossel, coming to you from the campus of the University of Oklahoma Health Sciences Center. And our program is a joint venture with Path Presenter and the Digital Pathology Association. So our cases today come from the realm of GI pathology. And I'd like to share with you a little bit about this unusual case in this realm. The patient was a 50-year-old woman, and she had developed a painful mass near the apex of the vulva and near the clitoris. So this was dissected out and found to be a centimeter or more and somewhat subcutaneous, but not into the deep tissues. And this sort of raises the interesting differential of painful superficial lesions. So I remember in medical school learning the acronym ANGEL for those lesions which would produce a painful cutaneous or subcutaneous mass. Angiolipoma, neuroma, glomus tumor, eccrine, leiomyoma, and so forth. But now if you Google that painful superficial lesion, you'll get a much longer acronym called blend tan egg, standing for this list of entities, many of which are, of course, the same, but a few additions have been added on, including dermatofibroma, tufted angioma, endometriosis, granular cell tumor on occasion, and the blue rubber bleb. So those need to be added to our differential considerations for this lesion, potentially if it's a skin-derived lesion, or if it's a primary GYN lesion, we may have to add even a further one to this list. So let's take a look at the sample. Here it is, somewhat fragmented, but lobulated appearance, rather cellular with a bit of fibrous tissue and vasculature in the mid portion. As we can see, as we come down to a higher magnification, these are somewhat epithelioid appearing cells, kind of round central nuclei, oftentimes fairly sharp cytoplasmic borders between cells, not a lot of pleomorphism. They look fairly bland, in fact. A little bit of variation, perhaps, in background vasculature. And on occasion, a few areas where you've got little slit-like spaces here, as you can see, in between some of the vessels, and sometimes between the actual cells themselves. So this looks like a low-grade lesion, not a malignant lesion that we would be concerned about, and it raises kind of an interesting differential. Are these epithelial cells? Are they myoepithelial cells? Are they perivascular cells? Are they nevus cells? All of these things kind of come into the differential based on the morphology of this lesion. So let me show you what some of the immunohistochemistry showed in this particular case. Really, the only two positive stains were vimentin and smooth muscle actin, and not keratin reactive, not a melanocytic or neural reactive tissue, CK7 negative, EMA negative, P6 negative. So we've kind of ruled out a lot of those things. And what we're left with is likely a glomus tumor. So this lesion is primarily a cutaneous tumor, and usually dermatopathologists are the ones dealing with it, or general pathologists, rather than GYN pathologists. It's most common around the fingers and toes and so forth, but in truth, it really can occur anywhere. And usually it's a very benign, banal tumor, such as we're seeing in this situation. There are some rare malignant variants, and the combination of the glomus cells, the sort of smooth muscle differentiation, and the delicate vasculature tends to support the diagnosis. Now, these are positive for smooth muscle markers. Calponin also would be expected to be marker H. caldesmon, and negative for cytokeratins and so forth. Emphasizing here that slit-like spaces are often seen. with these very, very round, punched out appearing nuclei. Now, in terms of differential diagnostic considerations, there are a number of other lesions that enter into the framework here. Not all of these would be painful, but some might be painful, like angioleiomyoma, the neuroendocrine tumors, and so forth. And then, of course, there are some variants where you get a differing degree of angiomatous or angiomyomatous differentiation in lesions. Malignancy is usually defined by, high-grade atypia, areas of necrosis, proliferation, and so forth, as you would expect for other locations as well. So I thought it would be interesting to just compare and contrast here a couple of those things that are in the differential diagnosis. This is a lesion that we've talked about previously in other areas, but as you can see, this has a lot of delicate spaces. This is a myopericytoma, and could also have some myogenic markers. This would not be expected to be a painful lesion in most circumstances. And I'll leave that slide there for you to study at your leisure. Additionally, this lesion has a lot of that same lobulated appearance, very vascular, some larger vessels. But I think as you come into higher magnification here, you begin to appreciate the small packeting of these cells, and that there may actually be kind of a degree of pleomorphism that's present here, as well as here you see these balls of cells, as it were, the infamous Zellballen of a paraganglioma, which again can be very vascular, but don't have quite that same vascular myogenic appearance that we see with the glomus tumor. And lastly, here an angioleiomyoma, which shows a degree of smooth muscle differentiation. Doesn't look particularly like this, the glomus tumor. And so not really a true histologic differentiator, but clinically this type of a lesion certainly could cause pain as well, and may on occasion have a very prominent vascular component to it. So in comparison, here's a couple of other glomus tumors. This one from the skin, obviously, within the dermis. And this one's showing quite a degree of vascular ectasia, almost peleosis-like appearance. But again, with these very uniform cells with nice round nuclei and no particular mitotic activity. Again, fairly sharp cell borders that I think you can see here, even in this lesion that's not very compact. And again, in this lesion, stained slightly differently, a little bit deeper, but again, very round, uniform nuclei, slit-like spaces, remember, we mentioned that, and a degree of vascularity. A lot of these slit-like capillary or endothelial line spaces. And this is a feature that we've seen in lesions elsewhere in the body, in the stomach. And so our final sign-out diagnosis on this case is a glomus tumor of periclitoral subcutaneous tissue. This is certainly the first case I have seen in this location, and bodes well for being broadly trained so that you can recognize things when the horse is in the dog kennel rather than the horse in the corral, so to speak. So thanks for joining us. I hope you enjoyed that. And if you did, please give us a like. You know the drill also, to hit that subscribe button so that you'll catch our future release. So until next time, I want to thank you for joining me and say adieu until then.